When my patients say they don't feel well, I believe them. But I didn't always see it that way. I was trained as a medical doctor to follow the evidence, to diagnose based on what could be measured, quantified, and explained. And for a long time, I believed that if the labs were normal, the patient was fine. Until one day, I wasn't fine, and nothing could explain it. Just 3 months after giving birth to my first child, I sat in a doctor's office. I was exhausted, foggy, aching. I was afraid. It should have been a joyful time, but instead, I felt like I was slowly disappearing inside my own body. My fatigue wasn't just from lack of sleep. This was heavy, consuming. My joint pains weren't mild ache, it was debilitating. My hair was falling out. My emotions, fragile. My brain just wasn't working like it used to. I knew something was wrong. But every test and every image I did said that I was fine. Just motherhood, they said. And I remember thinking, if I weren't a physician, I might have believed them. But I knew my body, and I knew this wasn't normal. That moment changed everything. It didn't just start my healing, but it reshaped the way I saw every patient, whether in the hospital or in my office. Eventually, I was diagnosed with an autoimmune disease. And yes, it gave me a name, but it didn't give me a roadmap. Because healing doesn't come from labeling a condition, it comes from actually understanding that person. So I went deeper, not just into my labs and the medications, but into my life. What was happening? What was my body trying to tell me? I began to look at healing from different aspects. Socially, emotionally, who and how I interacted with people, nutritionally, what was I eating, hormonally. I began asking different questions. Not just what's the diagnosis, what medication I'm going to use to treat, but what is my body actually trying to say and do? What triggered these events for my body to start attacking itself? That journey changed my practice forever. I learned health isn't black and white, and illness doesn't always wait for proof. Before that experience, I would have reassured a patient like myself, your labs look fine, everything looks great, I think you're okay. Not because I didn't care, but because I did not have concrete evidence. Now, when my patients say they don't feel well, I believe them, even when all their labs and imaging are normal. Even when there's no textbook explanation. Because the absence of evidence is not the absence of truth. The body doesn't always speak in numbers. Sometimes it whispers and it whispers until eventually it shouts. And if we're not actively listening, we will miss that message. So to my fellow providers, we don't need more time to listen. We need more intention. A validating sentence, such as I believe you, can be as powerful as a prescription. Curiosity is not a luxury, it's a clinical skill. Because too often, myself included, in our rush for efficiency, we do become mechanical. We follow algorithms while patients are sitting in front of us, falling through the cracks. I began to think of all the patients I had seen before my own diagnosis. The one who said, I just don't feel well. How many of them left my presence feeling unheard? Their experience is not anecdotal, it's a part of the evidence. So I believe we really need to stop thinking of intuition and storytelling as soft and integrate them into the way we evaluate our patients. I am not saying by any means we abandon evidence-based medicine. It saves lives. It's a necessity. I am suggesting that we expand that. We make room for nuances, for root cause investigations, for early intervention before symptoms become a diagnosis. Even inside this broken system, we can choose to pause, to ask better questions, to trust our instincts, to trust our patients. Healing begins with just 3 words. I believe you. One of my first patients I truly saw with these new eyes was a female. I'll call her Julie. She was 34-year-old, a teacher, a mother. She sat across from me and said, I don't recognize myself anymore. She'd seen 3 other doctors before seeing me. Was told it was possibly stress, depression. Her labs, Everything was really normal. Looked textbook perfect. But I saw it. The quiet ache of someone who's been dismissed too many times. And I remembered what that felt like. So I listened and I believed her. And we eventually figured out what was her condition. But the most powerful medicine I gave her wasn't a treatment plan or medications. It was a validation. Months later, she said, I'm not just getting through my day, I'm living it. And I thought, this is what happens when we listen and believe our patients before we start treatment. So, to all the patients out there, don't give up on yourself. If something feels off, something likely is. It's your body, and you know it. Medicine taught me how to treat a disease, but my body and my patients taught me how to find it and showed me what healing really looks like. Healing doesn't begin when we ask what's the diagnosis. It begins when we ask, what is our body trying to tell us? Because sometimes the most powerful medicine isn't in a vial or a scan. It's found in a moment of trust, a belief. So now when my patients say, I don't feel well, I don't just listen. I believe them. Thank you.